Hey, boy. Hey.
Hello again, this is Dr. Anthony Rakovic, Euclid Chiropractic Clinic in Upland. What I'll talk about today is a follow-up from our scoliosis series about posture exams, scoliosis exams. Okay, part of our last week we talked about early detection with scoliosis is important to make sure we get things looked at early enough before we need the bracing and the surgery, which is not very effective and very risky. What we're also going to do is an examination on more of our kids from 4 to 5 years old to about 2021. We can catch it early before the bones stop developing. With this exam today, the demonstration is going to be Mr. Riley. I caught him about 2 days ago. He's one of our patients, and to quick examine him and had one of the parents videotape him. So hope it's entertaining for you and obviously educational too. We do in our exam, in more detailed exam versus a school nurse or what have you in the schools, even medical doctors too. We do a front to back view, a side view, and also a view lying down, if you want to call it that, with under stomach. We check the hip rotation, also leg length. So walk through the exam that we're going to walk through right now, and hope it explains what's going on the whole way through. Mm-hmm. This is another video talking about posture with scoliosis. We want to check most of our youths, our young adults, and our children. I'm going to work with Riley and kind of show you what we look for. Okay, so I'll take a stand back. We look for really is going to be, look straight in, is shoulder height. And if shoulder is going to be level here, or is one higher than the other. Okay, beyond that, we want to see the hands too. Do the hands drop down one more than the other? Is one higher more than the other? We want to make sure that's going to be level overall. Let's have you do, take a little step out for me and face me. With scoliosis, we also check for posture too overall to make sure, right here for me, bring your feet forward a little bit, is to make sure the shoulders are level and the head sitting more over the shoulders versus in front. Okay, that tells us the shoulders do round forward, that the body is becoming more kyphotic, and that'll be a secondary condition from scoliosis. Okay, and one more thing, let's have you face that wall that way. The back point of view you want to look for is a couple things. Again, is the shoulder higher more than the other, or are they level? And with the shoulder, you can easier see here, sometimes the head will compensate to go to the lower side, so look for that too. Also look for shoulder blades and see where they are to make sure they're level, and make sure again the shoulders are going to be more turned here versus coming forward where it'd be more of a look. Also what they do more normally is the Adams test. So what I'm have you do is lean forward a little bit. Sometimes we'll see that shoulder pop out a little bit on the lower side, which it actually does on that side too. Coming up. Here's the second part of our posture exam with kids and scoliosis exam too. We want to check for hip unleveling left, either rotated here or rotated here. We want to check if it's here, what will happen is this left leg, being the left side and right side, want to drop on that side. Well, sometimes we'll see is that foot a little bit longer on that side versus the right side when we check the feet. Okay, what happens is we bring the feet up and they level out. What we want to do is rule in or rule out, as it's not because it's level here, it's not a lower leg problem where it's one short than the other. This is more here, coming from this side, being a little bit lower, from that side again, with the hip rotated this way, versus being level on that side. And what this will do overall with the spine is cause this to compensate by making this shoulder, like we saw with the posture exam, a little bit pushed out, a little bit lower on that side too. So the whole spine is affected by that scoliosis he's having to deal with right now. All right? That's it. Hope that makes sense to you. And as a parent myself, is we want to make sure you're informed. That's why I had a parent videotape the examination, which they've done before a couple times with Riley. We've seen Riley a backup history since he was 4 or 5 years old to where he is now about 12, 13 years old, in junior high. And his scoliosis was initially not so good. And if we had not treated him all the way through, to be honest, I almost guarantee that he would probably need bracing or surgery by now. Okay? Well, in our next video, we'll talk about and actually show you, demonstrate his x-rays of his follow-up exams and also his previous x-rays too, of what's going on and how we diagnose off those x-rays. So again, as parents, you're more informed. You understand that you're their primary care doctor, physician, healthcare practitioner, everything. And you have to understand what's important to keep your children healthy and hopefully avoid things like surgery if possible. Again, chiropractors are the most trained examiners of posture and things like scoliosis. And we take the x-rays very seriously. And sensitive x-rays are ways to correct things without drugs or surgery. Any questions, please give their office a call. If not, have a great day.